Now an important conversation. Over 2,000 immigrant families have been separated at the U.S.-Mexico border over the last couple of months. Parents are being criminally prosecuted for illegally trying to cross the border. Kids removed from their care. There's a lot to debate here, but we really wanted to dig into the science and the data. So Dr. Elizabeth Meade with Swedish Medical Center is here. You're a pediatrician, so I want to pick your brain about the science involved,
Sure.
If we can. So let's get to the bottom of what this actually could mean medically for these kids.
Well, there's a couple of big things that we often refer to in sort of child development, and one of those things is called ACEs, and that stands for Adverse Childhood Experiences. And what we know is that people who have undergone multiple ACEs as children have dramatically worse health outcomes as adults. So not just emotional and social and mental health, but really physical health, things like heart disease and COPD and all sorts of things that you might not associate with emotional trauma. The other thing we often talk about is toxic stress. And so people who have severe or prolonged stressful experiences, really without that buffer of sort of protective adult emotional relationships, can suffer long-term consequences. And that can even include remodeling of the structure of the brain.
So when you look at the photos, for example, of the kids on the green mats and the foil warming blankets, or in the chain link dividers, some have called them cages, some have said that's not what they are. I'll leave that debate for somebody else. But you can see the photos. From your medical opinion, kids in those kind of spaces, what are your concerns?
I think it's really important, as you said, to separate the immigration debate from what's happening in terms of this family separation, because they really are two different issues. And so separating these children, especially the young children, from their families at a time when they are already incredibly stressed and overwhelmed and scared, really not only has short-term acute effects on their well-being, but we anticipate very long-term, lifelong health consequences, potentially not only for them, but even for their children going forward.
Yeah, and let's talk about the parents as well, because the health impacts are not just for the kids, parents too.
Parents too, you know, and I think we absolutely worry about the parents as well. So these parents, I mean, can you imagine having your child taken from you and having no idea where they are, if they're safe, if they're okay, and really not even being able to communicate about it? I think it's a horrific thing that we're doing to these families, and I think that we are incredibly worried about the long-term ramifications here.
Yeah, let's talk more about that, because there are short-term impacts for sure, but I mean, it sounds like the greater danger really is for both groups, the kids and the parents, the long-term impacts.
That's absolutely right. So in the short term, this is a horrible, stressful experience, but what we really worry about are those changes to the brain structure and to development and ability to sort of relate emotionally to other people. The family structure certainly can have long-term difficulties even after people are reunited with their children. So the longer that kids are remaining separated from their adult caregivers, the more severe we anticipate those effects to be.
Which leads me to a question. I mean, kids are resilient. I mean, they themselves, their bodies can heal pretty quickly. So if this changed in the soon, these kids might be able to recover from this?
The sooner that we can reunify these children with their parents, the less severe impacts that we will see. But I think it's important to also recognize that even a short-term separation can have severe and dramatic effects on health.
We only have a couple more seconds left, but I wanted to ask you, the American Academy of Pediatrics, the president yesterday came out and said this was child abuse in her opinion. I want to ask you, is that what this is?
It's systematic child abuse. There's no question.
The solution being this particular aspect has to end, setting aside the immigration policy.
The solution being reunification of the families that are separated and immediate cessation of the practice of separating them. All
right. We appreciate you helping us understand the science, the medical aspect of all of this. Dr. Elizabeth Meade, Swedish Medical Center, thank you very much for being here.
Thanks for having me.